On April 30th, the Saskatchewan drug plan will move from covering 10 biologic drugs to their biosimilars. That means not paying for the expensive brand name drugs and instead paying for their lower cost versions. Biosimilars are not the same as generics. The province says this could save $20 million a year. Saskatchewan is the 6th province to make the move, but in other provinces, some patients have been concerned that the change could lead them to regress. It's the same here.
Being in a lot of pain and not really being able to do anything about it, and trying to navigate life without being able to just even use your hands properly or open a door. Or
McLeod was diagnosed with what's now called juvenile idiopathic arthritis when she was 12 years old. She was put on the first medication she had for months while doctors waited for it to kick in. McLeod says her condition appeared to worsen before being put on her current medication. Her condition was debilitating, and she's scared to go through that again.
for so many people, they might be able to switch and life will go on and there won't be much of a disruption. But there is that fear too, where it's just, what if it doesn't?
One expert says the data for some drugs will be extrapolated from other drug tests, like for inflammatory bowel disease. But despite that, he says biosimilars are held to a high standard and people shouldn't be concerned.
They should go into it with the same open mind they did in the first place when they started taking the biologic all those years ago.
Saskatchewan says people with concerns should talk to their doctors. And if they feel a patient needs to stay on a certain name brand drug for health reasons, a doctor can apply for an exemption. Bardell says with that, people may just need to take a leap of faith. Dane Patterson, CBC News, Saskatoon.